Welcome to the Friends of NPACE Podcast. My name is Josh Plotkin. I'm the Chief Operating Officer for NPACE, and today I'm thrilled to have Dr. Kathy Baldridge with us. We're going to be talking about the NPACE and APEA partnership that's been in existence, I think, for almost 4 or 5 years now.
Yeah.
And it's evolved over time. So we're going to get into the nitty-gritty about the NPACE and APEA partnership and how both organizations are working together to serve nurse practitioners. So, Kathy, it's a pleasure to have you with us today.
It's a pleasure to be here.
Awesome. If you could start us off by giving a little bit of background on yourself, what you do in your clinical practice first, and then second, what your ties to APEA are and the work that you're doing with that great organization.
Sure, I'd be happy to. So my name is Dr. Kathy Baldridge. I am from Alexandria, Louisiana, and I became a nurse practitioner in 2009, and that was my first encounter with APEA because I took their review course in preparation for the certification exam. And if you'd asked me at that time, did I ever imagine myself working for APEA in the future, I would have told you, no, you're crazy. But you never know where your journey is going to lead. And so I worked in primary care for a while and then did wind up working for Advanced Practice Education Associates. And I started that in 2015. I was writing test questions and running them for statistical analysis. So I wound up being the director of psychometrics, which I also would have never told you.
Who knew that was even a role?
Who knew? I know. And, we all hated statistics in school, so that's not something we dream of doing. But it was a great experience. And from that, multiple special projects, creating products for universities and for students, and then teaching review courses. So I've been there since 2015, and it's been a great journey.
Excellent. And so you touched on it a little bit in your introduction there. I think for those who might not know about APEA, can you talk about the review courses that they do, how they work with students,
Sure.
and sort of that part of the beginning part of their nurse practitioner journey?
Right. And so we do have products that we provide to universities, and we have products that will carry them from the entry level in the advanced practice space all the way to the certification exam. So we have question banks, questions with rationales that students can use to learn and grow throughout their schooling. And we have predictor exams, so that will predict the likelihood of passing the certification exam on the first attempt, which we all want to do. And then culminating in a review course. And the review course, we cover all the body systems. And, it really just brings everything into focus that you've learned during your 2 or 3 years in your APRN program prior to taking the certification exam.
Excellent. And so it's really this wholesome sort of, you're going to get everything you need to be prepared to go ahead and take that exam once it gets to that point of your journey. Awesome.
That's right.
And in terms of, I know APA has evolved immensely over the past few years in different ways that you can get involved. So can you talk about, you have your live review courses, correct?
We do.
And then you also have, I'm assuming, tons of online programs that folks can get involved in. Can you speak to both of those opportunities and where folks can pick and choose what they want to do?
Yeah, we do have some continuing education that is on the website, and that is one of the partnerships with NPACE that we're so excited about because we do try to focus more on the student side. But, as nurse practitioners, our learning never stops. So even after you get the certification exam, you have to continue to grow and learn as you experience new patients and new sometimes practice sites. And so that's been a great partnership because you all are in my book, leading authority on continuing education. You have great speakers, great topics, great things to expand our knowledge as we continue in the profession.
Excellent. I think that, when we sort of go back to how did this whole partnership between NPACE and APEA come to be, and I think Amelie and Jeannie, who have moved on to, having some fun in their retired life.
That's right.
But when they were with the organization, there was, and Amelie spoke for NPACE at several events previously, there was this discussion about how can we work together, but more so, and you touched on this, the career journey for nurse practitioners. Right. You start out as a student and you go through that rigorous process of getting yourself to the exam and getting the exam. then you're into clinical practice and you have to meet your continuing education needs. And I think the overall goal of NPACE and APEA working together is that there's this seamless transition of your education. So
Right.
as you mentioned, it doesn't just stop once you become a nurse practitioner with that exam. It's lifelong learning.
It's lifelong learning. In school, one of the things that they focus on is making sure that we understand evidence-based practice and clinical practice guidelines. And sometimes you get out there in your clinic setting and you really kind of go into a silo. And so you're seeing patients coming and going, and it's hard to keep up with everything that's changing in the medical world. And there are changes that are happening almost every day
Yeah.
because new research comes out, and it's almost impossible to keep up with unless you have continuing education
Right.
that makes sure that that brings that to you in the home where you are. And I can't devalue relationships. So that's what led me to APA, but that's also what led to this partnership
Yes.
between APA and NPACE was the professional relationships that were made throughout the years. And one of those being Amelie and Jeannie and Dr. Mimi Sakur,
Yes.
which is one of the founders of NPACE, I think, if I'm not mistaken there.
Yeah.
So
I believe a founder, been on the board.
yeah.
She's been involved since the founding.
She's
If
been
she
involved
wasn't
for
a
a long
founder
time.
herself.
Yeah, yeah. So those relationships is really what brought these two great companies together to make sure that there was a vast selection of continuing education to help nurse practitioners better take care of their patients in the community.
And I think that's the goal of both organizations working together, is just what you said there. I'd love to talk about some of the things that you're seeing when it comes to students and faculty and in that setting. What are students struggling with? Where do you see them needing more assistance? And what are some tips that you may have for students?
I see students hungry for knowledge. They really are. And they get a lot of it through the university setting. They are challenged with finding preceptors. Sometimes that is definitely a challenge that they face, is in finding preceptors. And sometimes they have to put school on hold just to find a preceptor to do clinical practice in. And those clinical experiences vary as well, depending on who your preceptor is, what setting you're in, what patients you get to encounter on a daily basis. And so sometimes there are gaps, and educational products can help fill those gaps.
Right.
And so case studies, questions that cover a wide variety of things. And so students are always hungry for that. And questions is a great place to start. Questions with rationales. It's not even so much about the questions. The meat of learning is really in the rationales and why the correct answer is right, why the incorrect answers are not correct. And it takes you back to pathophysiology and prescribing and kind of brings it all together for you. So that is one of the things that we're very proud of, is providing those question banks for students. And then the predictor exam, we get a lot of feedback from that because it is statistically predictive.
Right.
And so it really does give students a great measure of where your knowledge base is and what are the holes in your knowledge base. So you get a very detailed report that tells you if you missed a question in hypertension assessment, then that's an area that you need to go back and remediate. And so we get a lot of feedback from students. Some students tell us that it's a little bit harder than the certification exam. Some tell us it's a little bit easier than the certification exam. Some tell us about the same. But again, that depends on their knowledge base. But 100% across the board, they tell us that it helped them prepare for the certification exam. And that's the feedback that we love getting.
And I think that's what's most important, is it's getting them to the point where they feel prepared to go take that exam.
That's correct.
And the other part is that as they go through that process, not only is it just this preparation, but it's explanation.
It's
why
right.
Why is, if X happens, what's Y and Z?
Yeah.
Or if we didn't get to X, how do we get to X?
How do we get there?
Exactly.
Right.
In addition to students, what are some of the things that you see faculty dealing with?
So most of the time, faculty in the advanced practice space, we were really trained as clinicians.
Right.
We don't necessarily have education in how to build a curriculum, how to write test questions, how to read the analytics of the test questions to determine how we need to make that question better, or do we need to throw it out or give 2 points, or, all of those things that faculty deal with, because we were trained as clinicians, but we want to see our practice advance.
Right.
And so sometimes life leads you to be an educator. So that's one of the areas that I see faculty struggle with, is that they just don't have the educational tools. So that is one of the great things that NPACE has done, is provide modules for faculty, especially if you're one of those faculty members that do not have that educational background, that you can go see how to build curriculum, how to write questions, what are the rules around that, how to know if the question is a good question or a question that needs to be revised. So there's great information there. If you are a faculty that is struggling with that, I would encourage you to do that, because it's just a wealth of information.
Yeah, I appreciate you bringing that up. I think another partnership that NPACE has instituted is with NOMF, which is the National Organization of Nurse Practitioner Faculty. And they have, or we have co-developed that whole curriculum with them that's specific for faculty, as you just mentioned. And so when I started at NPACE, and we started to talk about, what can we do beyond continuing education? Who are the experts in terms of engaging with nurse practitioners throughout their career journey, which I think is the theme of our conversation today. That APEA are the folks that really get them when they get started. And NPACE is there for them when they graduate, take the exam, and enter into clinical practice. And I think folks work in clinical practice and get to a point where in their career where perhaps they want to transition, perhaps they want to add something else to their plate, like they need it.
I know.
But that NOMF then became a organization that's working with folks in that regard. And so there's now this partnership and links that NPACE has to both of these organizations, where we're working on content and jointly working with the fantastic teams at both places to make that, from the beginning of your journey through the time that, you decide to exit the journey, that there are resources there for you along the way. So thank you for bringing that up. I think the one thing for students, if you had one or two tips for them in preparing for their certification exam, what would those things be?
Well, I see students have a lot of anxiety, and having a little bit of anxiety is okay. I would be worried if they didn't have any anxiety at all, if they went into it thinking that they knew everything. So what I always try to start with is remind yourself. First of all, remind yourself, you are a great registered nurse. You took care of patients that the patients told you at the end of the day, I'm so glad you were my nurse today.
Yeah.
So sometimes you have to encourage yourself and remind yourself that I'm a good nurse and I'm going to be a great nurse practitioner. So that encouragement of yourself really takes you a long way. But make sure that you have the resources. And that's one of the things I love about the predictor exam. I'll go back to that, because if you've worked your whole nursing career in cardiology, then when you sit down to remediate or to study, you're going to tend to focus on cardiology because it makes you feel good.
Right.
Oh, yeah, I knew that answer. Oh, yeah, I knew that answer, because that is an area where you're comfortable. But Murphy follows us around. You know what Murphy's Law is? If it can go wrong, it's going to go wrong. And so Murphy follows you to the certification exam. And when you get there, it's going to seem like the first 20 or 25 questions are all about women's health.
Right.
And you don't know anything about women's health because you didn't study there. That's not an area that you feel comfortable in. It's actually an area that you are never going to indulge in. That's what you tell yourself. But that's what's going to show up. So that's what I love about the predictor exam, because it goes through all the knowledge areas and it shows you those areas where you're weak. So it brings it to you and it guides your development of a study plan. So that is key in getting to that certification exam and knowing the majority of the questions there so you can pass it.
Being comfortable with the uncomfortable.
That's right. That's right. And I always like to say, anything, if you're doing a Q-Bank question and you're reading a rationale and you say, but why? If you have a why, then you still have areas that you need to know about. So you go chase that why until all of your whys have been answered. That's where you're really filling in the gaps in
Right.
your knowledge areas.
And I think that's what's most important. I think you spoke on a few things there, that if there's an answer that you don't know, seek it out.
That's right.
Talk to your fellow students, talk to your faculty members. They might be able to help you. Folks that you've worked with in your own settings. I think that the resources are there for
The
folks.
resources are there. Yeah.
Excellent. I want to revisit something that you brought up, and it's the precepting situation.
Yeah.
And I know that that's been a super difficult thing for some folks to be able to accomplish, and sometimes becomes a roadblock or an obstacle. Can you talk about any resources that might be out there from a precepting perspective that you know of, or any tips that folks should know when it comes to precepting?
Okay. There are some tools to help you learn how to be a really good preceptor. AANP has a great website for that as well, that you can go find different modules if you're struggling with learning how to evaluate a student, or really how to guide that student, or how to even begin as a preceptor. For me, one of the things that I really loved to do when I was in the clinic a lot and precepting is I would have the students send me their curriculum vitae. I would look through that curriculum vitae, and then I would set up an interview with the student. Because if our personalities didn't jive well, then neither one of us are going to have a good experience. But it was one of the things that I felt like I really needed to give back to my profession to do. But there are guides to help you do that. So AANP is one. There is an initiative that was spearheaded by HRSA. There was a HRSA grant to develop preceptor resources.
Okay.
And so I know that those have been developed. I know that LSU Health Sciences Center has developed one for Region 6, but I think there are some national too that are really good preceptor resources. They even have a stipend that you can get if you've gone through their modules and then you're precepting students. So there are initiatives out there to help preceptors learn how to precept, be better preceptors. And then for students, I think it's important, again, the whys. If you go into a clinic setting and you have a preceptor, you still need to chase your whys. And your preceptor is going to be able to answer some of those for you, but you're going to take that home with you at night too. I always tell them, take a patient home with you at night and go over that. So still chase the whys. But when you're looking for a preceptor, first, join your professional organization in your state too, because that is where you start making those connections. And so a lot of times you'll pick up your preceptors there, but always be professional. Drop your CV off. If you do go for an interview, act like you're interviewing for a job, because it really is a job and it's going to lead to that. So just a few tips.
Awesome. We appreciate that. You brought up a few things when it comes to precepting that I want to touch on, and that's state organizations for nurse practitioners are a tremendous resource, not just for precepting, but for so many specifics when it comes to each state. We know that every state is
state's
different in terms of how nurse practitioners can practice. Is it full practice authority? Is it restricted? So on and so forth. So state organizations are fantastic resources. I also want to shout out, there's a company, we're not partners with them, but we've seen them online, is Preceptor Link. And I believe that they might be a little bit new, but they are doing work to try and link students to preceptors. So highly recommend that folks check them out on social media, and more resources that they have. So a few things there that folks can do. Excellent. Is there anything else, Kathy, when it comes to either the APEA and NPACE partnership that we want folks to know about, or just the entire sort of journey that folks take when they're with APEA and getting to the certification exam? Any parting words that you have for folks?
And you touched on something that I would like to close with, because the company APEA is an ATI derivative. And so ATI has long been in the nursing space, and the umbrella company is Ascend Learning. And we are very active in advocating for nurses and nurse practitioners and all healthcare professionals. And I think that is very important to bring to the table too, because we do have a great profession, and we do want to protect the rights that we have. And we do want to be at the table when decisions are being made. Nurses are very good about advocating for our patients, but advocacy for our profession has not always been at the top of our list, and sometimes it's a little bit uncomfortable. So I would encourage you to get involved in advocacy, whatever level you're at. Learn how to advocate for yourself, because believe me, decisions are being made about nursing and nurse practitioners, which ultimately impacts our patients. And they're being made without us at the table. And so then we find about things about later and we're like, oh, no, that's not going to work. We have to be at the table when those conversations are happening. So joining your professional organization, learning about bills that are happening at the federal and at the state level, letting your voice be heard, because we all have stories that we can tell. You don't need major talking points. Just go tell your story about your career and about your patients. So I'll leave it there. Get involved in advocacy. It's one of the things that I'm very passionate about.
I think that's a fantastic way to close. And the nurse practitioner profession, at least with the amount of time, almost 8 years that I've been involved with NPACE, has evolved so much to the point where I think, and I'll speak for primary care, and certainly specialties are a little bit different, but most folks, when they go into a clinical setting, are seeing a nurse practitioner.
Yes.
Or they're seeing a physician assistant. And so you are the first ones that a patient is interacting with. And so what Kathy just said is a huge take home. Advocate for yourself, advocate for what you know is right, get involved with the organizations that are working in that regard as well. So I think that's a fantastic place to leave our conversation off. So Kathy, thank you so much for taking time to be with us today. We're here live in Hilton Head. We got to do this together. So Kathy has delivered a few fantastic presentations for us here at this event as well, and we thank her for doing that. For some parting words when it comes to the podcast, we want to remind folks that you can check out the Friends of NPACE podcast on your favorite streaming platform, Apple Music, Spotify, Amazon, YouTube, wherever you get your podcasts, we are there. NPACE is an ANCC accredited provider of continuing education. We have 4 remaining in-person conferences taking place in 2024. If you want to come to the beach, 3 fantastic locations to choose from. We're here at the beach.
It's been beautiful.
It's been great, and beautiful weather as well. We have a conference in Boston as well over the summer, which no better time to be in Boston than the summertime. So check out our in-person conferences. If you can't make it in person, learn.npace.org, where you can find multiple courses that are all continuing education based, free resources as well. We talk about our partnership with APEA on there. And if there's anything that you need from an NPACE perspective, certainly check out our website, which is npace.org as well. So we thank everybody for tuning in for this episode of the Friends of NPACE podcast. Thank you, Kathy, for being with us. And we look forward to our next episode. We will see everybody soon. Thanks for tuning in.